Welcome back, Dr. Maria Azizian. Today we will be discussing fatigue as reflection of mitochondrial problem or mitochondrial disease. It is a very interesting topic, and of course it would be too ambitious of me to discuss every cause of fatigue, because fatigue is such a huge symptom that it could represent many mechanisms behind that. So today we will be talking about fatigue that is due to mitochondrial dysfunction, and it is intertwined and related to with a chronic fatigue syndrome. What is a fatigue that is not going away? What is a fatigue that you still feel after everything else has been checked out and everything else is okay, meaning that everything else was ruled out? Those are very exciting and interesting points and very exciting and interesting questions to look at when you're evaluating a patient with a fatigue. So a few things that I sort of organized in my head. So talking about mitochondria, the first thing, of course, is that mitochondria are located inside of the cell. They're organelles or structures, part of the cells, and their claim to fame or very important function, a life-preserving function or life-affirming function of mitochondria is production of energy, production of ATP. So essentially we are not alive without mitochondria. Mitochondria is the representation of life. So they make energy molecules of ATP. So they're called powerhouses of the cell. What are genetic origins? They are diseases that can come from mitochondrial DNA, or you can have a problem with mitochondria because regular nuclear DNA codes for erroneous DNA of the mitochondria. It is a very important concept because mitochondria has its own DNA. On that topic, there are differences or interesting sort of point about inheritance pattern, because with mitochondrial disorders, mitochondrial DNA disorders are maternally inherited because embryo gets that maternal DNA from the mother, obviously. Although you could have problems in your mitochondria inherited a regular way, but usually there are certain disorders that are encoded by mitochondrial DNA itself. And it's interesting also, you see a separate paragraphs, or not paragraph, a separate page in a lot of genetic testing about mitochondrial DNA inheritance pattern. So the next is, how do these diseases due to mitochondrial dysfunction present? So they could be very variable, but there are certain things that they have in common. For example, muscle weakness is very common, neurological issues, and less common, or I would say not less common, but vaguer symptoms, organ dysfunction, because organ dysfunction could manifest itself in many ways. So, and because mitochondria affects actually affects every reaction that happens in our body, sometimes it could be hard to diagnose that, because those mitochondrial disorders or diseases or aberrations, they can cause other problems, and those secondary issues contribute to our symptoms. That way it's very hard to diagnose the primary problem. So diagnosis of mitochondrial diseases are very complicated and very difficult. One of the things that we see a lot in mitochondrial disease is that they do worsen over time. That's very common. There are also treatment limitations with that, meaning that there's no specific cure right now. However, with improvement in the development of gene therapies, I am sure that will not be true for too long. There will be some cure or some remedy for these mitochondrial disorders. And potential therapies are, of course, linked with that, with the gene therapy, with even potentially with mitochondrial replacement, for example, medications to stabilize mitochondrial DNA. So looking at mitochondrial disorders, and especially looking at the fatigue, I do have to quote Dr. Elizabeth Ward from IFM, from Institute of Functional Medicine, where I'm certified, who really focuses on chronic fatigue. And she talks about how chronic fatigue not only includes exhaustion, heavy exhaustion all the time, but it also usually comes with other symptoms, and those other symptoms could be difficulty sleeping, or sometimes excessive sleep, difficulty with thinking and concentration, brain fog, and even chronic pain. In fact, there is a correlation between chronic fatigue and chronic pain. So, and in a lot of times in teaching about mitochondrial diseases, we talk about how mitochondrial disease could be a common disease presenting in uncommon way. And you can look at the fatigue, for example, how fatigue may be not going away, and that would be your wake-up call, or wake-up call for your provider, that we are dealing with something different. So a common disease that presents atypically, that actually is where a lot of clinicians, especially functional medicine clinicians, would start looking at mitochondrial disorder. But how do you diagnose that? Let's extrapolate a little bit more. How do you diagnose these mitochondrial disorders? Because you can treat the patient, run all kinds of tests just to exclude, for example, problems with deficiency in micronutrients such as vitamins or minerals. You can look at their enzymes, you can do a gut test, etc., etc. And then if everything is normal, or if you correct all of those aberrations and insufficiencies, then the next would be, how do you diagnose mitochondrial dysfunction? So mitochondrial dysfunction, interestingly, affects the organs or tissues in the body that use a lot of energies, and those are, of course, brain, muscle, and heart. So how does it help us? How does it help us in a sense of diagnosis? In a sense of diagnosis, what it helps is that what we can do, we can run some blood tests, and there's not really direct blood tests, but we can do some blood tests that show us the bioproducts of the muscle function. So those blood tests would be, for example, lactate or pyruvate blood tests. So that could be helpful. Another way to diagnose would be to do a muscle biopsy, for example. That is done, and that, of course, is a more invasive level of diagnosis. Despite the clinical suspicion, the diagnosis may not be certain, because what are we looking for? Are we looking for dysfunction of mitochondria? Are we looking for aberration in production of the mitochondrial DNA? So there are several sub-steps here, or I would say several steps to look at, and I am not sure that currently in what we offer to the patient we really go so methodically over those steps. And I think because there is still not enough research into mitochondrial health. There are some syndromes that affect especially eye and the brain that are known for mitochondrial disorders, which I'm not going to go into because thankfully they're not very common, and there is essentially no cure for them at this point. So, but how can we deal with our fatigue? The fatigue that that has some kind of a mitochondrial basis to it. let's say that it was diagnosed. Again, that's one of the challenges, to know that this is specifically a mitochondrial etiology to a certain diagnosis. So what do we do? So what do we look at? So several things that I would go over is, one of them, of course, is nutritional supplements. There is correlation, or there are some studies showing that coenzyme Q10 is helpful for the health of mitochondria, and that makes sense because coenzyme Q10 is very important for electron transport chain, which is very important in production of ATP, in production of energy. The next one is L-carnitine, which is actually used, I would say, quite widely, and of course a lot of people don't know exactly to the detail why they're using that, and they say, I'm using it for energy, but you know what, they're not wrong. They are using it for energy, to boost their energy level, because L-carnitine is important for the transport of fatty acids. So that's why inside of the mitochondria for energy production, so that's why it's important. B vitamins are good for usually for most of our body functions, unless somebody overdoes with them. That happens too. So we're looking at B1 thiamine, we're looking at B2 riboflavin, B3 niacin, and B6 pyridoxine. So those are important B vitamin, and also alpha lipoic acid, which is also helpful. And these supplements, they don't just come from just a random sort of citation of recommended supplements. They come because they are connected with how mitochondria produces energy, how mitochondria creates ATP, and those are components of production of ATP. So in a way, we are talking about biochemistry. So this is a purely biochemical recommendation, I would say. So in terms of the diet, one of the very helpful diets that have shown to work is a ketogenic diet. So it's a low carb diet, and a low carb, high fat diet, and that diet promotes production of ketones, and mitochondria can use those ketones for energy. So that's why that diet works. And of course, along with that diet, with ketogenic diet, there's also high protein diet, and high protein diet of course supports muscle health in general, and overall improves and increases energy. In terms of the other lifestyle, which of course we would like to always focus on the lifestyle, exercise is very important, because regular moderate exercise, it can enhance mitochondrial function, and also importantly increase the number of mitochondria in a cell. And of course I always have to say that exercise should be tailored to a person's ability and capacity. Pushing yourself through exercise may not be a good idea in many ways, especially without preparation. So, and gene therapy, as we discussed, gene therapy, that's we will put it sort of on the shelf until it's available. And other than that, with fatigue, let's say if there's a correlation of chronic pain with fatigue, addressing pain is important, because for people who are experiencing muscle pain, there has to be some kind of physical therapy or some kind of a therapeutic modality that would help them with the chronic pain. And also it is important to honor patients' symptom. If somebody is fatigued, pushing yourself all the time may not be such a good idea. So it's good to take breaks in whatever you do. I think that in life in general, it's good to push yourself, but it's also good to be kind to yourself. And especially in somebody who has a chronic fatigue syndrome, it is important to take breaks in whatever you do and honor how you feel, but then yet continue on. So very interesting. So we are looking at this paradigm of fatigue as manifestation of mitochondrial disorder, but I think that this is so little that that is being talked about. I think there's just so much more. And now there's this whole sort of study and research interest of talking about other common diseases, such as, for example, migraines, as a representation of mitochondrial issues. So, but maybe we'll talk about that next time. And as always, thank you very much for listening. Please like and subscribe if you enjoyed this video. Until next time, thanks. Bye-bye.